The Southeast Texas Geriatric Workforce Enhancement Program is a partnership between academic institutions, healthcare entities, and community-based organizations, all to ensure older adults live wonderful lives and that their families are supported throughout.
I think that one of the biggest things that it has done is created a much greater respect for our community partners. Being able to work with CarePartners and other community organizations has provided a lot of insight on how these organizations operate, the services they provide, and how they bring the community together for the service of older adults.
The relationship with the physicians have allowed us to build rapport with caregivers in a way that we may not have necessarily been able to, because they're making those direct referrals and making the more so warm handoff versus just giving them a flyer or information. They're able to say, hey, this is a partner of ours. We trust them, and they're going to be able to help you on the community side of things.
Because of this partnership, CarePartners has had the opportunity to work with some of the brightest minds in the field of aging.
So what I find most meaningful about working with older adults as well as their caregivers is providing medical care based on what matters to them. We know that when you're working with older adults, there are a wide variety of things that they may wish to gain from their healthcare. It's not a one-size-fits-all. And so within the Southeast Texas GWEP and in conjunction with CarePartners and other community-based organizations, we have really been focused on thinking about what older adults value and providing care that is aligned with that instead of simply aligned with a disease-specific model.
I think really all the work with older adults to me has always been very meaningful. People sometimes ask me why I became a geriatrician, and I really say honestly it's a calling for me in many ways. And I think when you can do it not just within the environment of a medical encounter or a healthcare system, but really touch people's lives in a more broad way, that's really meaningful. And that's where the Southeast Texas GWEP allows us to do that, is to touch older adults, especially those at risk and those who have more complex illness, to touch their lives and help them in just the broadest way possible.
The way that this collaboration has impacted the future of aging in our community, I think more broadly nationally, is in the impact of the teachings that we've done, especially around the Patient Priorities Care Initiative. This is a national initiative now. It's the preferred framework for addressing what matters in the Veterans Health Administration, which is a national healthcare system. It's one of the 2 endorsed strategies or approaches by the Institute for Healthcare Improvement. But we've trained 400 or so healthcare professionals over the last few years to use this approach. And so I think it's seeping into the cultural transformation in the way that we care for people who have lived a very long time.
The partnership is significant because of the fact that it's so many different professionals across just the aging landscape. You have social workers, you have physicians, you have nurses, and so you have people from different spaces in this, healthcare coming together to provide resources and support for one particular group.
CarePartners is honoring GWEP because they were able to bring together partners from across different disciplines and different areas of expertise to ensure the older adults and their families across the region get access to the resources they need and knowledge about ways they can live happy and healthy lives.